to start, hopefully. No more surprises, hopefully. To start, hopefully. No more surprises. So it's with my great pleasure today that I welcome the talk of Iris Parra Jonou. This would be probably our last presentation for No Bump No Care. Do I still have you here? Sì, okay. No, because at some point the screen went dark, but today everything is happening. So yeah, probably will be the last presentation for the year for No Bump No Care, which is a network of people, philosophical counselor, care ethicists, trainers, obstetricians who are taking care of reproductive rights and the reproductive journey. Iris Parra Jonou is a part-time professor and researcher at the philosophy department at the Autonomous University of Barcelona. She holds a PhD in moral and political philosophy, as well as previous undergraduate studies in nursing and humanities. Her research is focused on feminist care ethics, end of life, social determinants of health, and interrelation between health and the arts. She's the She's the Catalan translator of John Tronto's books, Care in Democracy and Who Cares. And today she's going to introduce us to a difficult topic, stillbirth. The title of the presentation is Look at Him. So thank you so much for being here, Iris. The floor is all yours.
Thank you very much. And I'm so happy that I could get to know this project that I didn't know about. And I think it's very interesting and helpful for so many people. As you said, this is a complicated topic. And while I was preparing this webinar, I looked at the webpage and it says that it deals with topics such as traumatic pregnancy, obstetric violence, abortion, postpartum depression, anxiety, postpartum rage. And so I just picked these ones because those are topics that appear, all of them, in the book that we are going to talk about, which is Look at Him, as it was translated into English. That is an original Russian novel written by the journalist and horror and sci-fi and fiction novelist Anna Starovinets. So Look at Him is also the name that it was given in English, and that's why it's also the name of this talk. And that's something we are going to discuss. So all these topics are going to be there. This project, to give some of my background, came because some of my close friends were having problems related to stillbirth and difficulties in pregnancy and so on. And some other of my friends were working as ICU neonatal nurses. And so I had both sides telling me difficulties on dealing with these topics. And then I came across this book while I was doing my research on care ethics. And well, I do have the Spanish copy here. It just came up in 2021. In Spanish, it's called Tienes que mirar, which would be more like you have to look. But and I just like mixed all the ideas and try to make sense of some topics that are really interesting on the book. So what I'm going to try to talk about here is the result that was also published as a book chapter in a collective book called Care Aesthetics and the Arts, which is completely available online for free. And so I will develop some of the ideas that are not there because you can all read the text there. So my idea is I will start by just mentioning some background of this book and this author, and then try to dive deep in some topics that I think are interesting for people who are committed to these topics or have to deal with them, either as the person living the situation, family members, healthcare professionals, broader society, and so on. And so I will first explain why choose a literary genre such as a memoir, which is a nonfiction, instead of a fiction, and then also some kind of an internal analysis of what are the ethical and aesthetical dimensions that can be of interest in related to this topic. And then a third aspect that I also found very interesting, which is more related to cultural differences and the impact that a book can have in changing policies around these topics, which was like an outcome, an expected outcome of this book. So as I said, Anna Starobinets is a well-known, especially in horror fiction and fantasy, novelist and also a journalist who had to leave Russia, and she's now exiled in Spain. And this book, Look at Him, is her only non-fiction book. So it's the only book that she didn't try to write as a fiction, and that's something interesting. It's based on experience that she suffered herself in 2012, and it was published in 2017, so 5 years after the traumatic events. And then the case itself. So in 2012, Starobinets found out in a 16-week routine pregnancy visit in Russia that her son-to-be would not survive because there was a severe kidney disease incompatible with life. And so there's this first diagnosis, and then there's second opinions, different opinions on how can this end. And then there's all this story on whether she have to be there in Russia or try to find a different place in Germany, where she ends up deciding to have an abortion because it was gonna die anyway. And then there's all this story of the post-abortion, in which she suffers a lot of panic attacks, and she's been like diagnosed as having some kind of neurosis and difficulties to just keep going with her life. And then like a third pregnancy, because that one was in the middle, she already had a daughter. And then the following pregnancy, in which she feels all the fears, like, am I gonna go through the same process again? And it actually succeeds, and she has another child. And then the final part of the book, it just all the family going back to the cemetery in Germany where the stillbirth was buried. So that's the whole story covered in the book. And in this book, she also makes a very clear statement saying that some healthcare institutions, some cultural backgrounds can help or difficult this process for women and for families. And so she creates a very specific dichotomy between Russia is a very bad place where you can live this experience, whereas in Western countries, this might be much more easy because it's easy to talk to it. There's more accompaniment to people and so on. So it's a bit of very opposite, like, and she specifically wants to, I think, emphasize this as a way to explain how bad it is for her in Russia. And so let's go back to the literary genre itself and the memoir, because it's true that memoirs, and it's something that we are very used to in Western countries, are usually used to explain something which is at the same time very personal, or a highly personal experience, whereas at the same time has something which is universal, and so other people could also understand this experience, right? Or it can even inspire others to change how they can feel about it. And so in the specific case of stillbirth, and in this case, a late termination of pregnancy because of fetal anomalies, those are very traumatic experiences, as we will see, and very unexpected, and with a severe impact on both women's and family members' physical, psychological, and social well-being. And not only it alters the pregnancy journey itself, but it also makes them feel very vulnerable, which also can raise existential questions about life and death in general. And so we need to consider two different things. Why she picked up a memoir then. So even if it's a nonfiction, it's not just like a testimony. It's not just a written summary of this is what happened. It's a literary genre, and there's some adaptations on the experience itself, and there's a literary work done to present the case. And so we don't have to forget that it's not just a report wanting to be very objective, or wanting to be like an interview in which I just explain my case. It's something that has been literally worked through. And so there's a use, very, very well-known use on metaphors. How do I present the information so I can have a sense, a feeling for the reader? And so there's all this work in which the experience, the core experience, is transformed also to create or to try to reproduce the experience itself. And so we don't have to take it just as a testimony, but also as a form of an artistical text. I think that's something interesting that it's important to keep, because that's one of the things that she plays one and again in the book. So one of the things, and it's seen from the start, is that it seems almost as a premonition, but she published another book in 2011, meaning 1 year before she experienced that herself, in which it starts more or less in the same way. So we have a protagonist that it's a very dystopian place in which every human have a coat, and so she's pregnant with a fetus that don't have any coat, and that's like challenging for the whole system, right? But it starts in the same way. So she goes for a routine pregnancy test, and then they discover that this kid is different from the others, and then she just asks, will I need to have an abortion? And so it's weird, because at the beginning of this nonfiction book, she remembers, oh, just 1 year ago, I was writing exactly the same experience that I found out 1 year later myself, right? And so she uses this as a way to say, when you live in your own life these experiences, it doesn't feel like real life. It feels like some kind of horror book. And so here again, she uses fiction and nonfiction as a way to say, these experiences are too much for us, that we just conceive them as forms of horror stories. And so there's some kind of dissociation from reality. And that's very interesting, because she's using some rhetorical devices in the text itself that helps us like confusing reality and fiction, which is one of the things that I find really interesting, also to make us remember it's not just like an objective testimony of what happens, but a recollection of memories and feelings and so on. And so one of the things that she says very early at the beginning is, well, why did I do that? So she said, after I terminated my pregnancy, I felt I need to absorb somebody else's experience that were similar to mine. So I read some books, but they were in English, and language, even if I understand English, it's a problem because it creates some kind of barrier, and it's not my experience itself. So she wrote this book for Russian people, especially Russian women who were going through the same process, right? And so she said that she wrote this book as a social mission to start some public discussion on the topic and break silence, correct the system, and help grieving people, but also as a form of self-care. So it also helped her going through this recollection of ideas. And so, as I said, it's something interesting, because she's saying all the time, this is too personal, it's too real life, it's not literature, it's the truth. But at the same time, she's all the time trying to make us think that it's a horror story and not real life. And so we have this contradiction all the time, right? And so when we just go into the topic itself, as I said, she wants to recreate this aesthetic experience to the reader too, so they can understand. So she maintains narrative tension. She merges the medical language with very lyrical images. She uses like satirical and acid humor, and so also a lot of self-deprecation, like she's calling herself a rat. She's calling herself a lot of bad stuff. And there's all these different ways in which she just tries to like make you understand a bit what was this process about. So as I said, since the very beginning, she starts the book by saying, it's one thing to dream up scary stories and another thing entirely to become the main character of a horror tale yourself, right? And here we also have the idea of tale, which is, again, not real life, but something different, right? And she's using this sense of unreality with fictional mechanisms. So, for example, in different pages, different moments on the novel, we can find like, we all seem to be playing a scene from a soap opera, for example. That's one quote. Everything after that takes place as if in a theater. And then in another moment it says, as if I'm the main character in a low-budget art house melodrama, as if all of it isn't really happening to me, just a movie. So we always have this tension between fiction and reality. And then, of course, what I told you about, that she quotes herself from the previous book in this book. And so then if we consider, so that would be like, why is she choosing this genre? But then if we consider ethical and aesthetical aspects that are within the text, there's a lot of material that we can use to make ethical reflections on these topics. And I reread the book today just to remember, because that was written like 2 years ago, but I went back to the book and I said, oh, there's way more things that I didn't put on my previous text that are also very important, and that people could just go there and try to reflect on, oh, there's this ethical problem, there's this other ethical problem, and it's so full of ethical problems that we could analyze. And, you know, sometimes literature is used as a way to help people understand bioethical problems. I would say as an instrument. Don't forget that it's still literature, so I think that's also important to have in mind. But there's some ethical and aesthetical ideas there that are important. And one of the things that I wanted to think about and reflect about, and that was what I tried to do, is, okay, why don't I try to just understand this experience and the way she explains that from a care ethicist perspective, right? And so I'm not sure if you are aware about Joan Tronto's work on care ethics and democratic care and things like this, but I basically use her idea of there's different layers on who is responsible for each stage of care. And so after that, there was a 6 phase, there's five phases according to her. So there's two of them which are much more related to organization, like who's gonna take the responsibility to find needs of people, who's gonna decide which assets do we need to respond to these needs. And then there's 2 other layers which are like hands-on caregiving, and then care receivers saying if that was enough or not, or if there's some needs that weren't covered or things like this. And then we have the final phase that Toronto reflect on, which was like having social network in which everyone cares for the others. And so we need that in all the other phases so it works well. And then some years after that, James Thompson, which comes from the arts and all, I think he comes from dramatic arts as a background, added a 6th phase and proposed a 6th phase, which is the aesthetic dimension. And he called that witnessing care. So it's not just about doing all this and the ethical problems or dilemmas related to each of these phases. So who's going to be responsible for that? Who's going to pay for that? Who's going to do the handwork? How is this going to be reevaluated and so on? But also what we experience while doing all this. And so he introduces the aesthetic dimension of that. And so one of the things that I think it's interesting from this book is the aesthetic, is that this aesthetic part is very, very introduced very sensitively, I would say. And it helps you understand how this is all the time merged with the other dimensions, which could be just analyzed as ethic dimensions, and that's it. And so we have this 6th dimension, which is witnessing care or experiencing, like touch, the voice sound, if the person looks at you in the eye or not, and that's some part of the title itself. Like, look at him. It's all the time a matter of who is looking at who, or who is not, or does not want to look at who. And that's also very interesting because it also helps, and I'm going to give some examples of this, to the person feeling more or less cared for. And that's also interesting. So, as I said, this book was thought to be a way to help other female people who were readers and going through similar losses to give them some suggestions. Like there's sometimes here and there in which she says, if you have to go through this process, never go there alone. So there's some like direct comments, like you should do this or you shouldn't do this, or if you do this, know that this happened to me, so I wouldn't recommend it. So there's some kind of this, but at the same time, there's always this other more literary aspects of it. Like there's some scenes that you can compare, never directly related, but for example, there's one scene in which she has to go to the bathroom because as a pregnant woman, she needs to go to the bathroom more often. And so in one moment, she says, no, you cannot go there because you don't have special shoes to come in, and so whatever. And then there's a different moment in the text in which they say, no, please go ahead. There's no problem. Why are you asking if you need anything to come in, right? And so those are just examples to just like create a connection between different scenes and as a literary mechanism to create the whole story itself. And it also resonates with previous things. She never do the direct comparison. She never say, oh, here happened this and there happened that, and that's much better. She just create these kind of comparisons that you just have to think about later. So it's also interesting. And so again, when I try to analyze these 6 phases, if we include Thompson's 2 previous Toronto's phases, we see how performing or not performing have direct impacts on people at different levels. So I wanted to check what happens in each level. And so people can find things related to all these levels within the novel. But if you're just interested in one of the levels, it's also interesting in the sense that it gives some information of each level. And so it also helps us understand that it's not just a matter of what people say or don't say in a private relationship within a healthcare office between a doctor and the person. It is a much broader problem, right? And so we have I would say, the more general level, which is laws and policies and regulatory frameworks for abortion, perinatal death, and sexual and reproductive rights. And those have direct impacts on the options given to the person who is suffering this situation, right? And so, for example, at that time in 2012, the Russian legislation established that none of the non-specialized clinics, whether public or private, had the authorization to practice such abortions. And so there were just some clinics specifically in which they could access to this abortion. And of course, there was a lot of stigma related to it and so on. So having or not having possibilities in legal terms and in the broader system also have an impact on what can you access and what can you not access. Also, it have some kind of definitions of what happens when there's a lot of bureaucracy involved or less bureaucracy involved, and how this also affects a lot the process itself. Then we could have what I would say healthcare institutions or health institutions as providers of healthcare services. And so here I found that there's like 2 layers on that. So on the one side, understanding which assets are available. Do we have general hospitals? Do we have specialized centers? Are they available everywhere or just in big cities or things like this? And then which protocols are working within the healthcare systems? And so what comfort measures do we have? Are they adaptable to different situations or not? And here I have an example. I think that it's very, very, I would say it's very simple, but at the same time very important, because there's a place in which she just shares space with pregnant women after knowing that she's not gonna make it with her pregnancy. And she just say all these clinics with balloons, with Your Little One magazines, the photograph of infants, the bras for future mamas, they aren't for rats, because she's already a rat, because she's not gonna have her baby. And she said, let the rats leave through the back door. Future mamas come through the front door, but I'm not expecting already. I'm not expecting anymore. I'm simple a rat. And so here it's just a way to say, hey, we might need different spaces for different situations, right? And it's something very simple, but at the same time, very impactful. And so here it also includes the awareness of these aesthetic or architectural or design choices that are also part of this continuum of care. And then the other example within the healthcare institution is that in Russian maternity hospitals, husbands are not allowed in. And so she can never go with the husband inside. And so the husband also have a problem with it, because he cannot be part of the whole process. And he feels like, I cannot have my own space and I'm also grieving, right? And so that was also another issue. Then if we go to hands-on professionals and the role of healthcare professionals and healthcare practice, we can see some of the images that she presents that are clearly unethical according to our perspective. For example, there's one situation in which she goes to a very well-known expert to have a second opinion. And he says, okay, I'm gonna go and look at you. You don't have any prior visit, but I'm gonna just jump you in and we can look at it. And then he just like make a quick looking at it, and he said, yeah, I think that's something worth seeing. And then all of a sudden, without any previous information about it, 15 people come in. She's already like open legs, completely nude, and she says, here I just dissociate myself and I'm two different people. And then that's one of the literary resources that she's using to express this. So dissociation is one. Since the first moment in which she's given the first diagnosis, she says, that's the first time I split in two. And then it's explained, the whole story is told from two different voices, two different narrators. There's the first person experience, which is her, and then there's like a second her, which is the journalist that can be objective and try to explain everything without feeling anything. And that's one of the things that she uses to express, here that was too much for me and I dissociated. And then there's this other person, which is also me, but the other me, it's explaining what I cannot explain. So that's one of the things that she uses. And for example, here a small quote: it seems that at the moment, for the first time, I split in two. With shaking hands, one of me wipes the gel off my stomach, but the other me, attentively and calmly, watches the first and the doctor as well, and she's generally quite observant. And here it appears this process like several times, every time that she feels that someone is mistreating her, basically, because when there's a good care involved, that doesn't happen. And so you can also see this. And then other ways in which she expresses this relationship with hands-on care and healthcare professionals is through gestures or lack of them. For example, if you have an ultrasound and there's some cream left, they just tell you, clean yourself, instead of, here you have some tissues or whatever, right? And then some kind of metaphor, and also the use of, the way in which that person was speaking just like had a change in the tone, and then I knew that something was not doing good, and so on. And also change of wording itself. So the baby becomes the fetus or becomes the embryo, and so it changes at the moment that they know that the baby is not going to make it, no? And then at some point, another healthcare professional keeps telling it like, it's a baby. It's still a baby. And so that also changed a lot their perspective on, yeah, it's still a baby. No, it's not a baby. And that also helped them think about the ethical aspects of what that loss meant. So for example, here another example, that's another second opinion, and says he finally spits the berry because it was sour in the mouth, because he didn't know how to say the news. So he finally spits the berry and says in a very formal medical terminology that the fetus has an anomaly. And then quoting, it's possible that the fetus has polycystic kidney disease, he says, wipe yourself and get dressed. And that's it. Like, and then she continues and says, well, after that, I just pay for the visit and I lose myself within the clinic and I don't find my way out, and so on. And then she is just in the car and she's just like, I cannot breathe. There's no way I can do that. And so you can see the physical result of the person having a panic attack after receiving this news with no further information. But we also have good examples of this interaction. And so we have a third opinion, because she did a lot of second and third opinion, in which she said, that voice doesn't say anything new, nothing I wouldn't have heard, but it sounds calm and also sad. And it says, be patient. And it calls me sweetie, and my baby a baby and not a fetus. And it calls Badger, that's the name that they use for the family members, Badger, little Badger, and so on. And my folks. And it says, I'm very sorry. It's simply a good human voice, no more and no less, right? And that's another way in which the wording, the way you express things also helps feeling cared, even if the news are exactly the same. Then we have the familiar and social response, because of course you need physical, emotional, but also economical support sometimes, because in their case, they need to pay because it was a private German hospital, so they need to collect money from everyone. So everyone collected the money and give them the money to go there, friends, neighbors, and so on. And so this close circle, it also, there's one moment in which the kid doesn't say anything. The older daughter of the family don't ask questions, don't say anything. And she says, don't you have any question about what happened there in Germany? And she said, no, I cannot. I do have some questions, but I cannot ask. And then the mother said, why can you not ask? She said, no, grandpa and grandma said to me that I could not tell these stories because you would feel bad about it. And then all of a sudden you can see all these like, yeah, let's move on. That didn't happen. We don't want to make you feel bad. And so we just don't talk about the topic. And sometimes this might be even worse for the person who wants to remember, right? And so there's always these other aspects of it, like how do the other people around also deal with this situation? So we do have an experience with the daughter who goes to us a psychologist, and there's all this information also there. And then, of course, the protagonists, which in this case are the woman itself, Starovinets, and her husband, because he also goes through a different process. And you can also see that, which is even more difficult to find, I think, testimonies of grieving fathers, right? And so that was also there. It's related to guilt, to not knowing what was best, with sadness, whether they want to have another kid or not afterwards, which is the role of each one, because the woman at some point it's so under attack and panic and don't know how to deal with anything. And the father is also in a bad situation, but he's like, you need to be the both now. You need to be the one taking care of your wife and try to help, even if you are having your own problems yourself. And so there's always like, and at some point, she also says, like, in Russia, after a stillbirth or a loss of a child, most marriages just split and divorce, and it's the end of the marriage itself. And so there's also some reflections on how to keep going as a marriage when you go through all these topics. So here it's like all these could be analyzed in all these differences, but then I said there's still another layer. So for example, it's also very interesting when you find so the woman, when she's along the book, since she discovered the diagnosis until she has the abortion, there are similar situations in which she just say, I cannot breathe. And that's also another metaphor that comes every time. And it's not just I'm having a panic attack, but it's also when she is giving birth to the death baby. At some point, there's like a connection between them two as if they were just one. And so when the baby is born dead, she said, I'm also dying. And she doesn't want to breathe and she doesn't want to open the eyes. And it feels like they are just one. And then it says, after about another 10 minutes, comes the understanding that the baby and I are no longer one. I'm alive and he's dead. It's he and not I who doesn't breathe and doesn't feel his own skin. It's he who lies alone now in the cold with the face covered up. Like, I need to understand that I have to keep living, and it's not me the one dying, but it was very difficult for her to understand this situation. And it's also within this metaphor of cannot breathe, which is what happens, like my baby's dying, I'm dying. And then there's a lot of work that can be done there. It's very interesting in very different analysis that you can do in terms of ethical aspects, but I wanted to just jump. And with that, I'm gonna like go into conclusions and we can discuss a lot about it. Like what happened with the book as a book and also as a social artifact to discuss these topics, not just a private reading, but also what happens at the social level. So one of the things that she decided to do is using real names. in the book. So she says the names of the people who didn't treat her well and so on. So the Russian version of the book and the English translation follow the same structure, have two parts. So the first part is this one, the story, which is called Us, which is this memoir that I described. And then there's a part two, which is called Others. And it's a much more journalistic and straightforward, like qualitative research that includes 3 interviews with healthcare professionals and interviews with Russian women who had the same experience in Russia. She could not interview healthcare professionals from Russia because they didn't want to participate. But this second side, it also includes like statistics of these kind of problems in Russia and so on. And it says that it was because the Russian editor had like an impression that the book wouldn't be well considered because that was kind of a really taboo in the society. And so they needed like something else apart from just a particular experience. And so they wanted to provide more of an objective, more information about the topic. I discovered, because I first read the Spanish one doesn't have this second part. And the editor says that it's because we as a society already have discussed that a lot, and there's no need to justify that we have this kind of text being published. And so people wouldn't be like very stressed if you just find out on the bookshop. But there in Russia, that seems very problematic. And it's true that when you go and see the first receptions of the book in Russia, it was deeply criticized by many people. And they basically said, you are making profit on people suffering because you are earning money for the book and things like this. You are trespassing the boundaries of social acceptability. And so there were a lot of personal attacks against her for doing that. But it also happens that some people in private say, hey, I went through a similar experience. Thanks for sharing this. So both things happen, one in public and the other one more private. There's also a lot of reflection. And if you want to know more about it, the prologue of the English translation written by the translator itself also explains a bit more like this context in the why in Russia that was a very huge problem. But in general, so the book there challenged this conservative mentality in which a woman in labor wasn't supposed to cry out in pain and ask for special treatment. And it defies assumptions about these gender roles, private public spaces, and topics related to what they consider like very intimate problems that should be not shared with other people. And then she was accused of manipulation, of emotional blackmail, because of the use of this first person experience. But it also happened something related or similar to a Me Too, in the sense that a doctor was, who is mentioned in the book, resigned from their place. Some clinics organized training sessions on how to communicate bad news to pregnant people. And also there was a hospital funded in Moscow for women experiences pregnancies for fetal anomalies. And that was a result of this huge discussion going on about the book. So there were some social changes and healthcare institutional changes. And so it also helped changing the process itself. What is interesting is that here in Spain, it came up in 2021 as a translation, in a moment in which at the same time there were some discussions of some changes in the abortion law, in which they were considering whether stillbirth, which is a word that we don't have in Spanish, we just call it like perinatal loss, but we don't say something like stillbirth. So if they should or should not be recognized or like put into the official record as a born child with a name and so on. And so it was at the same time on the press, and the thing was there. And there were also some like experiences in cemeteries finding their place for stillbirth babies and so on. And so back then it was a topic that was already like in the news, on the press. And it's interesting because as the book appeared, there were several book clubs related to let's meet and discuss these topics. And that's also interesting because, for example, in the memoir itself, there's one moment in which she just go through all these online websites in which people just comment things and exchange ideas. And of course, there were a lot also of, you are doing a bad thing, you are killing your baby, so all these, I think like people trying to make you feel bad or even more worse for the situation. And so she also said, well, if we can have a different approach to that, I think that will also help. And so it happened here in Spain, and it was interesting that many book clubs appeared because of this. And yeah, I think I will leave it here because I guess that this also might happen in different places and cultures, but it was a way to see that it's true that there's some kind of universal experience in the sense itself of that being so traumatic, losing your child, but at the same time, depending on the context you are in, it might be more easy or difficult to work on that. But I wanted to just like make a statement on the political impact that a literary book can have in terms of changing things. Yeah.
Thank you. Thank you, Iris. Wow, thanks. Thank you for. I didn't know this book. I'm running to to buy it. I have so many questions. I have one invitation because so far I managed to. I interviewed. I gave the space for. The recipients of this kind of healthcare. I would be really very curious to hear the part of the healthcare system, you know, that compassion fatigue. I remember when I received in my late 20s the diagnosis of the fatal diagnosis of my mother. The doctor was so mean and harsh and unclear. And I was young, and they said, I understand. Why do you have to be so mean with me? And I remember his face changed completely, and he felt, I think, a little ashamed, and the tone shifted. While you were telling that story of the doctor saying, okay, now you can wipe yourself, I don't know, this came up again. I would be really curious to be in their mind, to know what kind of struggle, how can we help that part so we can get along. So it brought me lots of hope when at the end of your presentation you said that there was a structural change within the healthcare system. I'm sorry it happened in a bad way because it happened from scolding these people, but it's necessary. I don't know what they go through when yeah, I don't know. Yeah, Karel, Tooms, they talk about the asymmetry of, you know, the people receiving the diagnosis and the person, the doctor has to give, I don't know, 10 bad diagnoses in a day. Yeah, the world changes for the two, but yeah, we need to find a way because we cannot create so many traumas in one's life. And also another note about grieving fathers. That's so true. What do they live? What do they experience? How can we create an environment that is respectful and caring for grieving fathers? Because the narrative of you need to be strong, you need to keep this thing going because the mother is suffering more, can't be helpful. And Martin Robb, I don't know if you got this, but yeah. Yeah, because you did the interview with him as well. Yeah, he has this wonderful podcast, Careful Thinking, and he's an expert in this area of, in this line of research with grieving fathers. So where should I start asking you questions? I don't know if any of you on YouTube or online have questions, please jump up before me because I really want to hear your voice. Personally, I'm curious how I know that you said that your friends were experiencing this, but you know, it's a Russian book with explicit Russian sensitivity, a Russian mission. How did you land there?
So, as I said, it was published into Spanish in 2021, and it's an independent publisher that I sometimes like buy
And that
books
was my
from.
question also. Sorry if I can jump. But yeah, can you tell me a little bit about the Spanish publisher, the Russian publisher? Because I mean, it's a courageous action to decide to publish this book.
So I think it's much more courageous in Russia. So I know that the Russian editor find it very difficult to just publish that, and that's why they had to include part two and so on. But here, I mean, it's not it's not at all a problem. I wouldn't say in Spain it's not a problem to just find this published. It's just another memoir exploring traumatic experiences. And I think we also have some people here in Spain, authors who have written similar things. So for example, we have Paula Bonet. She's an artist. She also lost a child, and she published a book and some paintings about that. So it's not something new, and it's not something that has been on public press before. It's an independent publisher, that's true, but it's just like another book on the catalog. I mean, it's not something very it's important to have this translated, but it's not a challenge to publish such a book. So in that case, I think it's a bit different. I don't know how the editor find out about that other book. I'm not sure about, but it's true that they also publish the fiction books of the author, and so I guess you just discover the nonfiction one and find it interesting.
I don't know, where do I go?
I
Go ahead.
must say, even if it is very related to the Russian experience, there's also the German clinic, and the German clinic is not that different from ours. And so they have a psychologist visit, for example, which is something that you are not offered in Russia back then in 2012. And so there are some things in the way. So for example, in the German clinic, they also say you can have some private time with your dead child before we just take it to the morgue. And you might want to take a picture of it. You might want to spend some time with it. That's something that we also can do here. And so you can find similarities with the German experience, for example.
Yes, one thing I didn't understand in the story. In Italy, I don't know about the US. In Italy, it happens that when you discover malformation, they indirectly push you to deliver the child normally, so to arrive at the end of the pregnancy and deliver the stillbirth baby. It seems that the experience of this woman was different. She managed to abort the child, right?
So it's both in Russia and Germany, they say child is gonna die anyway. You can either just go through labor when it's a time, or get an abortion before that. In both situations, she's offered this. And I've been checking on the Spanish legislation, and it's also possible to do an abortion for fetal anomalies at any point of the pregnancy. I'm quite sure that it's not the same situation in the States, although I don't know the laws there. But in this case, so when she went to the Russian clinics, what they basically told her is you should have an abortion right away. And she's like, well, I'm not really sure about that. I need some time to think. I need to know if there's any option that this kid can just make it to 9 months and then born and so on. And then when she goes to Germany, they also tell her like this kid is not gonna make it because there's no liquid enough within it, and so it's gonna suffer a lot, and it's gonna die anyway through massive complications within yourself. And so when this happens, she's also offered like, do you want to do an abortion or not? And also, do you want it to have like a little injection so the baby dies through the injection and not through the brain damage of being dying within? And so there's a lot of discussion between her, the doctors, and the husband about what is better? Is it better to let it suffer? And so there's another case explained in which the doctor tells her, well, you can decide whether we use this or not, but if you don't, let me tell you about another case. And she explains another case in which a child make it to term and was born, but then died within very few hours after what we could call like therapeutic obstinacy. Like it explains that there was a lot of mistreatment and how the over technologization of that kid who lived like just a few hours was so traumatic for everyone that was not ethical. And so that experience also helps her understand, okay, yes, that's the alternative. So I don't want to do that. No.
Yeah. Yeah, I cannot do these webinars anymore. Yeah, I arrive in the midst with tears. So it's because for some reason I can feel it in my body how immensely hard these decisions are. Bioethics, and this is something I tend to say a lot in my research, bioethics tend to present cases in a very clear-cut way and very impersonal. But they are incredibly painful and difficult decisions when, yeah, they are in your life.
Yes, and there's also all these other that I haven't mentioned much, but for example, she has lots of problems eating afterwards, and she has panic attacks every time she goes out of the house and so on. And so she's been told, you need to go to some doctor or psychologist or something. You cannot continue like this. And then she goes to the clinic and the neurologist, because they were like just testing her in case she had something. And they said, no, but we do have psychologists. Why don't you go there? And the psychologist basically said to her, you are having like some kind of psychiatric problem with food. So you are going to be locked in this room. And she said, no, I don't want to be locked in because I have like problems with food. It's not that, it's another thing. So you can see also this like things getting worse and worse. And there's another specific moment in which she goes and buys a pizza, and then she gets stuck in the middle of the street, like, I cannot move, I cannot move, I cannot move. And then the husband has to come and pick her up because she's just so overwhelmed. And of course, then you can ask yourself, well, why is it interesting for me to know that particular circumstance? Does it mean that everyone is going to suffer the same? No, everyone's not going to suffer the same. And it will depend on very different experiences, previous resources that you have, networks that you might have. And so it's not that we use these books as, hey, this is what's going to happen. It's just like, this is one way in which things gonna happen. And if we have different examples of it, we can have a broader picture on, okay, what might happen if you find a situation like this. Really? But it's not any solution as how can we deal with that?
No, but as she writes in the title, we need to look. I mean, we need to have a sight, a glimpse of these experiences, because saying, okay, go to the psychologist is not the answer. The psychologists too need to collect enough experiences, enough ways in which the body speaks to you. I mean, the bit you were narrating about her, oh God, I cannot even tell the bit. I mean, her experiencing the death of a child with her body. I mean, of course, it reflects in a way in which she nourishing herself. She tries to keep going while a part of her is in that unity.
It's also nice in a way too, because she creates like a similarity between this son that was not alive and then the following son that made it and it's alive up to this date and so on. Because she said in both cases, you have to look at him, both of them, the one who survived and the one who did not. But it also is the same with this particular experience when she was giving birth to the dead one, which is what I read. Like he has closed eyes. I have closed eyes. I cannot breathe. He cannot breathe. I need to understand that we are two different people from now on. But then when she's having this third child, she's also screaming a lot, not breathing, and just with the eyes closed. And the midwife is telling her, breathe and open your eyes. You have your son here. So it's again like a parallelism. And you can see that the experience was the same in some way, even if the result was different. And so that's also a nice way to say they all have the same importance and place in my life. And that was also nice, without having to say, hey kids, for me you are all the same. It's through the way in which she explains the story that you came to understand this.
I will run and buy this book.
I mean, I don't know the author personally. It's not that I want everyone to read her, but I really found that there was something in this book, as in some books that just come once and again, that touches something which is, as I said, kind of universal. And even if I'm not a mother, I haven't had any child, but you can understand some situations. You can feel that, oh, this must be really, really problematic if you go through this. And I've been a nurse, so I can imagine how hard it has to be to just be there in that situation.
I can feel that too. This shift of languages that she describes.
And I think that's the nice part. It's not just a testimony. There's an artistic talent in how to express this, so you can get that feeling.
Absolutely. Thank you so much, Iris. I see 5 people online. Joshua here on Zoom. Is there anyone willing? Do you want to ask a question before we say goodbye? Okay. I see something.
Moralizing abortion affects women's experiences. I'm sorry, I'm reading.
Yeah, go ahead.
Do you think that the moralizing abortion affects women's experiences with and feelings, and that there is a place to discuss their emotions with birthing experiences such as the one in the book? Okay. And I'm an American race male. Well, we like to talk about this not just with women or women who are mothers, so it's good. Moralizing abortion. So does it mean thinking that abortion is either good or bad in general, or what do you mean exactly by moralizing abortion? Because of course, please go ahead and ask. Yes, you're muted.
I was thinking that because there's so much discussion about how bad abortion is, that the losing of a child in preterm or that makes it difficult to have a place to discuss those types of things, and if perhaps they become tantamount, and makes it so that people don't feel comfortable discussing them. My wife had a miscarriage. I have several friends whose partners have had miscarriages. Her mother was encouraged to carry a child that they knew would not survive to full term, and it really seems to weigh on women, and it also doesn't seem to be terribly uncommon. Yet when it occurs to the women that I know of that it has occurred to, they're unaware of all these other people around them that have had similar experiences. And I wonder if having a place to talk about it and it being a little more public and known would reduce the devastation. And I don't know that it would. It's a devastating situation anyway, but
thanks for clarifying this. So I think I have to make a distinction. So in this case, in the book, it ends up being an abortion because it was a little interjection, and the birth was like provoked by pills. So in that case, we have something related to, is it ethical to abort? And that's one of the huge discussions that you are having again in the United States, for example. It's slightly different when it's spontaneous. Like you said, there's a miscarriage, and it could be also, so in the case that it's written in the book, it could also have been just a miscarriage because the baby wouldn't survive anyway. But some people find it different if it's natural, so to say. So it's, or if there's any involvement from the medical system. So one thing would be if we moralize one action or the other, which I think might be slightly different in ethical debates in some specific countries. But in general, of course, so I come from Spain, and Spain used to be a very Catholic country. It's more like cultural Catholic these days, and many people don't follow the Catholic religion, but we do have a lot of, and we still have some challenging to abortion itself. And so, of course, I remember when speaking with my friends, and one of my friends had an abortion or a miscarriage. Sorry, it was a miscarriage after 7 weeks. So it was like pretty at the beginning, and it was Christmas time. And she said, if that ever happens to me, I want to talk to you about it. So I don't want to just say nothing and just keep going as such. And that's some kind of a pact that we did with my friends. Like, if any of us go through this process, we would feel good to share it with others. So I do believe that whatever the topic is, if you are going through a traumatic experience and you don't know that that's common, and you don't know that other people also suffer that, you are going to feel like the problem is yours, and you're going to be more, or feel more guilty about it, and you don't know to whom you can talk to, or if you're going to be like at some point stigmatized for having lived that, or even accused of having gone through some kind of experiences. So I do believe that the context in which you live this experience changes a lot your whole process. Does that mean that even if you have your whole family and friends around surrounding you and you can talk to them about it, does it make it easier? Well, there's some kind of part of the loss that's never going to be easier. Like, you are going through a loss, and that's painful, and that's always going to be there. So in a sense, that's something that you will need to suffer anyway, but it changes a lot. That's my experience and what I've been found on the literature. It changes a lot if it's something publicly recognized than if it's not. And just by having the option of naming it, or even, for example, here, are you gonna have like work leave for how many days? Like some things which are like very administrative, if you want to, like, do I need to go back to work the following day? Because if it's not something recognized, I might need to work the following day. But if it's something that it's legally recognized, I might have some days to just cope with it, even if it's not enough, or that we can consider if that's enough or not, or if it should be better or not. But of course, I would say being public, being a topic that you can discuss, that you're not going to be directly threatened just to mention it, also helps a lot with how you deal with it. Yes, sure.
And if I may add, Iris, to this
Yes, sure.
very good answer and question, what we don't consider about spontaneous miscarriages, and I had one, is that for weeks, days, it depends on the situation, you live through the experience of walking in the world around with a with a dream that died inside you. I mean, you are living, and in your womb there's something dead, and you know that, and you don't know when this death is going to be born. I mean, it's devastating to live that in your body. And in the movies, in the stories, in normal narrations, they sell us the idea of, oh, the stick, it's positive, I'm pregnant, and then it seems okay. Flash forward the day after, you are hearing the beating heart of this fetus inside you. It's 3 weeks afterwards. 3 weeks are extremely long. And if you start feeling cramps, you start having the first drops of blood, you need to go to an emergency room. It's incredibly complex, those 3 weeks. And if you receive the bad news, I'm sorry, there's no heartbeat, you have even more days to carry this dead life around with you, and you have to go to do classes if you're a teacher, but in any case you have to do you have to carry on with your normal life,
Yes.
which really creates the kind of split that author was talking about, because it's crazy, it's maddening. How can life go on? How should I carry on my life when this is happening? And sometimes it happens that you miscarry in days. So it's not that, boom, I miscarry, it happened once, it's done. In my case, it took 2 weeks. You carry on 2 weeks of your life, and in the bathroom. I mean, it's crazy. And I don't know, so far I didn't run into descriptions that, touch the, how gross and alienating the experience can be.
I think one of the interesting sections of this book is that it focuses on the bad care aspect in very, very concrete images. For example, there's also this moment in which there's several moments in which there is like an in-between. Like you need to wait 2 weeks to know if that's good or not. You need to wait 3 days. So when the baby was already like almost dead because there were no amniotic liquid left, and she was deciding whether to include an injection or no, and she didn't know what to do. There were 3 days in which she was there, like, again, what you said, like, this kid is already half dead within me and it's gonna be born at some point. And even afterwards, when that already happened and they tell her like, hey, everything's been like, there's nothing left within the womb, so there's not going to be an infection and so on, she just like goes to the shower and feels the milk popping, and then she's given a pill for that, and so it stops. But you are like, and then you can do breast milk donor, or you can become a breast milk donor and things like this. But it's also like your body doesn't understand it after several days or weeks later. Like, there's a dissociation because the realities just are confronted, and there's no way that it ends.
That's a very good point. How do you tell the body? Because the body needs its time and needs its grievance. And you have to keep going, because until yesterday, a miscarriage was compared to a fever. There's a webinar I did with Alison Stone, and she said that her doctor told her, yeah, come on, this is just like a flu, move on. How can you move on? And to do what? To go to work? We are not saving lives. I mean, I'm not saving any life personally. There's not this pressure. Come on, nobody's.
And then I think, so I'm 36, and I think in my generation we saw a shift, which is I've been raised telling people all the time, like all the time, people telling me, you're gonna get pregnant, watch out, watch out, watch out, it might happen at any time, the first time you have sex with someone, and you get like some kind of scared of being pregnant very easily. And that's something like we discussed it with some friends, like And I think it's good, I mean, good in the sense that it's good to know that this might happen, that you need to get protected and so on, but you never get the other side of the story. You might spend 3 years trying to conceive and not being able to, and just feeling that something is wrong within your body, and then someone tells you like, this happens all the time. Like, I don't know, I'm just gonna, if I just come and see people around me, I can find, as you said, Joshua, several people that went through these processes, or people that already have some problems, either he or she, or, I mean, there's several complications that can also happen, and you are never told about them until you find yourself in it. And so I think it's good to have both situations in mind. Like, hey, for some people it might be really fast, but for some other it might take a lot. And what happens if you've gone through 3-4 miscarriages? Should I keep trying? It's always going to be the same. So in the book, for example, there are some genetic things related to it, and at some point they tell you it's 50-50. So the third child had a 50% of possibilities to get the disease or not, and they were like, well, 50-50, what do we do? The responsibility to also have this. And I think it's just, so if you know all these things, you know better what you can expect. Like, that's a possibility. You have to know that that's also a possibility, even if it never happens, which is good, because you never want to do something that you didn't want to, right?
Thanks. Yeah, that's why I make this space to create a dialogue on different problems. And infertility, I mean, is another infertility or genetic issues, especially after several miscarriages. How do you approach that technology? How do you approach adoption? How do you approach the alternatives if you want to? There was one webinar in which we touched a little bit on that, on the artificial womb and artificial placenta. Anyway, yeah, thank you, Iris. Thank you so much for bringing up to this table today. Thanks, the Joshuas, for staying here with us. I would love to invite more people, fathers, men, healthcare professionals, to see how this translates in their daily language. We'll see. For now, No Bump No Care will take a break.
Yes.
To recover from all these experiences. Thank you so much, Iris. I wish you a wonderful rest of your weekend, because we're close to the weekend today. Yes.
I am. Great. Well, thank you so much for having me there. It was a pleasure.
For me as well. Bye. Have a good day and beautiful trip to Italy.
Thank you. Bye, Josh.